The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today I'm joined by Juan Alatorre. Juan is from North Carolina, and he's a testicular cancer survivor. Juan, thank you so much for being here today.
Thanks for having me. I really appreciate it.
So first, let's start off by introducing yourself. Who are you and what do you do?
All right. So again, my name is Juan Alatorre. I'm 48 years old, and I'm originally from San Diego, California. I've been in North Carolina now for 6 years, and I'm an operations support manager for a travel management company. And then, of course, my hobbies besides traveling are playing as softball on the weekends if I can, a lot of tournaments as well. So
awesome. All right. So the reason we're here today is to talk about testicular cancer, of which you are a survivor, as mentioned. Kind of take me through like when you were first diagnosed. I know in your submission that you noted that you were doing your regular checks.
correct. Yes. So I'm a big advocate and hey, check yourself. I do it in the shower about every week or so. And it happened on February 16th of 2018. I was in the shower and I noticed that one ball was just a lot bigger than the other one. And it didn't hurt to squeeze it a bit. It just was kind of odd and it was harder. So I thought, well, I wonder what this is. I actually sent a message to a doctor friend of mine, and he said, oh, it could be a varicocele or something like that. There could be water in there. So, wait a couple of days to see if the swelling goes down. So that was on a Friday. Monday, the 19th, nothing, swelling did not go down. So I called my GP and he said, okay, go ahead and come in. Right away, he had me, he looked at it. He said, go get an ultrasound. It was the next day, I think. That came back and said, that does not look good. It looks like there's a mass in there. And so they got me that Friday to go see that was on Friday and then the following Friday. So then on Monday, then the 26th of February, 10 days later, I go see the urologist. He checks it out. He says, it looks like that is cancer. And we're going to have to remove it. And I'd never been sick a day in my life. So I didn't really know what to expect. It was kind of scary. And he said, I'm quite busy today, but let me see when we can get you in. Well, I was waiting there and he said, oh, we've got a spot at 4:30 today. You're not going back to work. You're going to go, we have to have that removed, It was just a very crazy day. But literally it went from, I did it in 10 days. It was gone in 10 days.
Wow.
From when I found it to when it was gone. So that's kind of how it happened.
So let's jump back. And so you were doing your self checks. What kind of made you even aware of that? Because a lot of people that I've talked to, it's not even something that ever crossed their mind. So for you to have already been doing it, that's great.
Well, it's knowing your body more than anything. A lot of, unfortunately, and it's what I put later on in my questions, a lot of guys think it's embarrassing. They think they're playing with themselves or whatever. But no, luckily, testicular cancer is one of the very few cancers that's actually noticeable. Unlike if you get something that's an interior type of cancer that just appears all of a sudden. And hey, you know what? Honestly, your balls, they're they're an important part of your manhood. And so you want to make sure that everything down there is copacetic, as they say. And so I was checking like once a week, like I said, and all of a sudden I noticed that growth, and it shocked me. I said, this is not normal. So.
And you were how old when you were diagnosed?
So I was 43.
Okay. So TCAF says the range is 15 to 44. So you were right in there.
Exactly. Well, and originally anything I had known about TC, I originally thought it was 15 to 34. But then when I went to the urologist and he told me it was cancer, he said that they had recently raised it to 44. So yeah, I was right in there.
So when you were told that it was the C word, what were you thinking then?
Well, like I said, I was told that and I got it taken out that same day. I just had a couple of hours to process it while I was kind of in the waiting area and they were getting me prepped and everything. I didn't know what stage it was going to be because obviously they didn't biopsy it, because I asked about that and he said, well, to biopsy it, we have to open you up anyway to take out some of the, So why go through that twice? And I didn't really know this urologist. So I'm like, well, can I trust to his judgment? But I said, well, do I want to be opened up twice if it is cancer? So I said, you know what, just take it out if it is. And I was just really kind of shocked. Yes, cancer does run in my family, unfortunately. But the fact that it was testicular, I was like, wow. I really thought, okay, am I not going to be able to get an erection, and just, get my normal manly functions? And I cleared that up with him, and he explained to me that that's not going to be the case. But not knowing what stage it was and how advanced it was, that was probably the scariest thing.
So what were your next steps after your orchiectomy? Recovery, and then you had to make some decisions about the next steps for treatment.
Yeah, so luckily, that was on a Monday, February 26th. And of course, the next 3 days until I actually got the results were probably the three hardest days and most nerve-wracking days, because obviously he's removed a ball without really knowing if it's cancer or not, and then if it is, how advanced it is. So it was 3 days of just complete uncertainty. I couldn't really sleep. When he called me on Thursday and he said, hey, it was stage 1 non-seminoma, or seminoma with negative margins, that it looked good, the fact that it was only stage 1. And he said, all right, we're going to still send, there's a possibility you could do chemo or, just some follow-up. So they were going to send me to the oncologist. And so I visited an oncologist about a month and a half later, and they gave me two options. They said, well, based on your numbers, we can do follow-ups about every 6 months for about 5 years. There's about a 15% chance recurrence. Or we can do one double dose of carboplatin chemo, which should lower the risk to about 2, 3, 4% the most. I thought about it. I said, well, even if it's one double dose of chemo, it's just going in there one time. I shouldn't have the side effects of people that, have later stage cancers that go in quite honestly. I was afraid, okay, is my hair going to fall out kind of thing. But when he said it's really just one time, and if it's going to reduce the risk by that much, I said, let me just do that. So I decided to do the one double dose of the carboplatin.
Talk to me about your experience with carboplatin, because I think, I could be incorrect, but I think you're the first one I've talked to who had carboplatin.
Honestly, I was in the chemo room for maybe 4 hours or something. Because again, it was one double dose. I actually did not have any side effects. 3 days later, maybe I had a bit of a stomach ache, but that was it. Actually, and to go back to your recovery, I apologize for that. So the day I had the surgery, I walked out that day. That was on a Monday. I missed work on Tuesday. I kind of stayed home. I had to sleep on my, because the incision was the upper left part of the upper groin area. So I'm a side sleeper, so I had to sleep on my couch so that I wouldn't purposely turn around and put pressure on there. And then I went back to work on Wednesday just because I was bored. They allowed me to wear sweats. I said, hey, am I okay to wear sweats? I just, and honestly, to me, and I have a high threshold for pain. So I was maybe about a 7. So I only took the medication for about 2 days, and then I just dealt with it. Of course, they put that jock strap on you and things like that, and you got to wear that. So, but other than that, I was fine. And again, the carboplatin for me was not. It did not give me any side effects. So
that's great. With your familial history with cancer, did that affect your decision making at all with your treatments?
No, I said, hey, you know what? If it's going to reduce it, then yeah. And now I was the youngest in my family, because both my grandparents on my father's side, and then an aunt and an uncle on his side, all got it, but they were already in their 50s or later. So I said, you know what? I have a lot of life to live, and so I just said, you know what? If I can reduce this risk, why not? Keep it at 15 or reduce it down to maybe 3 or 4. And with one session, to me, it was a no-brainer.
Gotcha. Okay. So you were 2018. So we're recording this on January 29th, 2023. This will come out March 1st. So you will be just about 5
5 years.
years out, which is the benchmark for like being clear. So talk to me about, each year and the follow-up appointments and how that kind of affects you.
Well, it's funny because I call it scanxiety. So that was February of 18, of course. February, yeah, that December was really kind of my first follow up, and each year, 19, 20, 21, all the numbers were great. It was pretty much they didn't see anything. So December of 22, December 21. Even though it was only 3 years, because after the first year, so 18, and so it was 18. In 19, December 19, which was the second follow-up, he basically said, you know what, these numbers are so low. Instead of doing them every 6 months, we'll just do them a year. So did them in December 20. And then in December 21, he said, you know what, these numbers are just, there's nothing there. So basically in December 2021, he basically said, you know what, I'm going to declare you cancer-free. It was really only 3.5 years. Because, I'm doing the CT scans and everything. But I asked him, I said, for my own peace of mind, is there any way I can continue this? It's invasive and things like that, but just the way cancer appeared all of a sudden, I mean, it can come back somewhere else. And I wanted to have my own peace of mind. So he did say, well, unfortunately, after I've declared you cancer free, of course, your insurance is not going to cover a CT scan because those are expensive. So if anything, maybe we can do a chest x-ray. And actually, I just got it done this past Thursday, and I'm waiting for my results. I'll have the follow-up next Thursday, the 2nd, with him. It was the first chest x-ray I got because he said most insurance companies are not going to deny chest x-ray. And you could still see, a lot of what the CT scans check out. But I do tell you that I'm fine all year long. I don't even think about it, except for the 1 week, when I first go get the blood drawn, and then they were doing the CT scan or in this case, the chest x-ray. That 1 week of waiting and talking to the urologist again, it's that scanxiety. Just, I'm like, oh my God, is there something in there? Is there something in there? To me, that's probably the hardest week of my year. So.
Yeah, I'm the exact same way. It's interesting that your doctor, I guess the insurance would not allow the scans after he declared you. It seems like, I don't know the insurance. I'm not a doctor, but if 5 years is the benchmark, it seems like they would allow like up to 5 years. I don't know. It seems.
Yeah. But what he told me is because, he pretty much, said would have to report to them that everything was, pretty much done in his opinion, that to them it would be, I could do it, but then it would kind of have to be out of my pocket or a lot more out of my pockets, So we're going to revert to the chest x-ray, and, and he said, yeah, that should not be a problem. So, it's better than nothing, at least for me. A lot of people would be like, okay, I'm done. He's declared me cancer free. I'm good to go. But I want some sort of peace of mind if I can.
Yeah. And I'm glad you bring up the chest x-ray because I can't recall ever talking about it on this podcast. And a lot of people I see on the testicular cancer support group are talking about, I got a chest x-ray scheduled. Is that normal? Like, because testicular cancer, you don't think about your chest, but that is the common kind of follow-up for.
Well, yes. And he explained to me that because it's not so much the recurrence of the actual testicular cancer, even though some people get a second one, it's more where it spreads, and it spreads usually up. That's why the CT scans, when they inject all that ink inside of you, it's really looking at the lymph nodes and going into the lungs and things like that. So it goes up for the most part. That's why the chest x-ray, even though I'm done, is still important because they might not see every little thing as the CT scan would see, but they're seeing, the main areas. So that's why.
What kind of long-term differences have you seen or noticed after testicular cancer, long-term side effects?
Can I speak bluntly?
Yeah.
On here? Okay. It's more a little bit of ED sometimes. Not completely, but it's one of those things where, if I get hard, it's kind of like I have to act on it now because I can lose that erection quickly. And then it's hard for, where before I could maintain it a lot longer, without losing it now that's probably That's probably the biggest effect. I do sometimes get what feels like maybe a hernia, where I feel like pulling on the inside. And one of the times I went to the urologist on the follow-ups, I asked him about that, and he checked to see if it was a hernia. He said no. He said it's the scar tissue from the operation. So your scar tissue is healing. So sometimes you might take a step or whatever, and you feel like, oh, or sometimes I'd be sitting on my desk working, and I would feel kind of like pulling inside my groin area. I'm thinking, oh my God, now I got a hernia. And he said, no, it's just whatever it is. It's a scar tissue that's healing, and it's normal. So
That's still to this day, or that was earlier on?
that was earlier. I haven't had it in about a year and a half or 2 years.
All right. So we have a question on the submission about whether or not you have had kids before chemo or before treatment and bank sperm and everything. And in your answer, you said that no, because you're a gay man. So I want to talk about kind of testicular cancer in the LGBTQ plus community, and if you know anything about it, and how it's kind of talked about there.
To be honest with you, Stephen, it's actually not talked about much, even in our community. I mean, as a gay man, obviously, your balls are quite important and everything like that. But it's still just a kind of a taboo subject, no matter in what community you talk about. But it can also be a bit of a topic as well, because if you're going to meet someone, let's say, you don't have a partner, or, whatever your sexual situation is, you're going to meet someone, and, if you start talking about intimacy or something, say, hey, you know what, have you been with a uniballer before? And then, that conversation comes up, like, what do you mean by that? Oh, I've never been with a guy that has only one ball, and then they start to ask, how does that work? I mean, you kind of have to educate them that, hey, everything luckily still works fine. Because one of the things that my urologist told me when he said that it was cancer and he has to remove, I said, so am I going to lose, be able to get an erection or ejaculate or anything like that? And he basically said, no, that as males, we produce all of our hormones in 1/4 of one testicle. So one is more than enough. So I actually kind of joked with him. I said, so why do we have two? Is it for balance or something like that? So, but no, I mean, it's still kind of taboo in the LGBTQ plus community as well. But I don't think as many gay men have a problem, doing their self checks as a, heterosexual man, because I mean, it is what it is. You're down there a lot anyway, or you could have your partner, your male partner or spouse, whatever, check it for you as well too. I mean, they can notice a lot of stuff too. Being another male, they can notice any anomalies as well too. So that there is an advantage in that regards. If you're one that doesn't get used to, aren't used to checking or check yourself, if you're sexually active with your partner or various partners, they can, as males, they know what's wrong, or they know if something's wrong, so they can tell you as well. So there's pros and cons.
Yeah. It sounds pretty well, like, positively received when you're sharing it with other guys.
Yeah. I mean, for the most part, yeah. I mean, it's like, hey, to be honest with you, as long as it works, that's kind of what, so.
All right. So in survivorship, I mean, your doctor kind of declared you at an earlier date. Since then, you still have this scanxiety. What does the future look like as you pass the 5-year mark? What is the talk of your surveillance now? Is there going to be any surveillance?
Well, like I said, so technically, yeah, it'll be 5 years next month. I do have my follow-up with him on Thursday for my first chest x-ray this past Thursday. I'm going to talk to him, and if I can continue doing the chest x-rays each year, I'm going to do that. I'd rather know, hey, I mean, if that can detect some sort of anomaly in my lung area, lymph nodes or whatever, it's better than just living life. It would save me this anxiety for a week or so a year. But to me, that's better, having that anxiety and knowing that there's something there, as opposed to just living my life and then discovering something that's stage 3 or stage 4, kind of thing. So if I'm going to talk to him about it, but if I can continue doing the chest X-rays, I'll do it. I mean, it's not a painful procedure at all or anything like that. It's just, some time out of my mornings, so.
Yeah. Talk to me about your like treatment facilities, because you're in North Carolina. So what's around you and what are the big centers if you went to a big center?
Yeah, so Cone Health is in Greensboro, where I am, is probably the biggest medical facility, and they sent me to the urology center that I first got after I got the ultrasound is part of Cone Health, and then that's where they remove the nut, and then Wesley Long Cancer Center is part of Cone Health. And that's where I went to talk to the oncologist, and that's where they did the chemo for me. So the good thing with North Carolina, they do have quite a good medical facilities too. So
that's awesome.
Yeah.
Is there anything else that you want to share that I didn't ask about?
Well, sometimes I will tell you, sometimes when I read other people's testimonies, and I see how bad they had it, with RIPLND and all this other stuff, stage 3 and even stage 2 with the BEP and all that. One of the hardest things for me is sometimes I feel like I shouldn't be considered a survivor because my journey was very, I don't want to say, what's the word I'm looking for? I was very lucky. But sometimes I feel compared to other people, should I really call myself a survivor? But what my husband tells me, he says, hey, they took your nut out. You're not, cancer took that from you. So you are a survivor. But sometimes it's just hard to mentally see that when you see other people that had the same disease and, and they were a lot worse. Now, the other thing that I really, want to emphasize from this, and I think I put it on my paperwork, is no matter who you are, don't be ashamed to touch yourself, to check yourself, because testicular cancer, granted, yes, it is probably one of the most survivable cancers, but if it's caught early, it is also one of the fastest growing cancers as well. I mean, in 2 weeks, you can go from different stages, So if you say, oh, I don't want to touch myself because I'm ashamed or, very macho or whatever, and who cares, who your doctor is, whether it's another male and he has to touch you down there, who cares? I mean, hey, if he has to touch you down there, just suck it up because he could be saving your life. That's the way I see it.
Yeah. Well, you definitely are a survivor. And I remembered you putting that in there and I read it in my email, but I think the printer ran out of ink. So,
okay.
But that's great. I mean, somebody just recently said the other day in a group chat we have with a bunch of local TC guys that, we're all in different boats in the same rocky water. So, everybody's got their own story, but we're all going through it.
Oh yeah. Yeah. And I really feel it's what makes me unique and it's what makes me who I am,
And you mentioned your husband. Was your husband around at the time of this or did you guys meet after?
Oh, no, he was around. He was around. The only thing that was kind of surprising for him is because, I went to the urologist after the what do you call it? The ultrasound, and my GP said, we got to get you to the urologist now. I went there on my lunch break. I was working and I said, because I really thought, okay, yes, they see a mass there. I really thought, oh, he's going to look at it. He's going to give me some sort of antibiotic or something like that to make the swelling go down or whatever. I didn't really think that it would even be cancer. So I went there on my lunch break. I left my computer at work and everything. And for him to tell me, for him to, for the urologist to go out and say, let me see when I can get you in, after he told me that he thought it was cancer. And I really thought, okay, he's going to come back and say, oh, come back in 2 or 3 days. And the fact that he comes back and says, we can get you into the OR at 4:30 today. Operation should be about an hour and a half recovery, and you should be gone by like 7:30. So my husband was still working, and all of a sudden I had to call him. I had to leave him a message and say, hey, by the way, I can't talk anymore. They're prepping me for surgery. He didn't, that shocked him, but he didn't get to the hospital until I was already out of the surgery, because it was so fast.
Yeah. So what kind of effect did that have on your husband? You know, not even knowing what was going on, you left him a message and he came after the surgery.
Well, I mean, he was kind of scared. He was like, "Oh my God, are you okay?" More than anything, just the fact that he knew I'd never been. He was worried for me because I'd never been sick a day in my life, never been in the hospital, and all of a sudden, he sees me in the recovery area. Of course, he was very worried. Okay, was I going to need help out, whatever I needed? And he was. I mean, honestly, he did. He asked me. He said, "Well, did you ask how it's going to affect our sex life and things like that as well, too?" And I told him. I said, from what I was told, because honestly, I really thought, hey, I'm never going to function again. And that's when my urologist told me that it's not prostate cancer. Prostate cancer is a lot more invasive in that regard. And that's when he told me about how, I should still be able to get hard. And, so he asked me about that. And of course, any help that I need. I told him, I said, me, I've got the big pain threshold. Don't worry. I just have to sleep on the couch for about a week or so, or however long I need to. So if I don't come to bed in the middle of the night, but no, he was there. He was very supportive. Of course, he was scared, but when we found out, it was Monday. When we found out on Thursday, that it was just stage 1. It was a relief for both of us, so.
Is he doing his self-checks now, or was he before?
He was not before. He is now. Yes.
That's good. Hey, you're saving a life.
Well, and that's the biggest thing. If anything from my story, I just tell people, hey, that's why I said, don't be ashamed. Don't let that macho get in the way, because, it's not worth it.
Yeah.
It's your life.
Juan Alatorre, thank you so much for being on It Takes Balls. I appreciate it so much.
Thanks to you. I really appreciate it.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.